Dr. Rahila Mungi. She is my PhD thesis uh, student, PhD scholar of my department, and the topic of the defense was a comparative study on prebiotics and probiotics in obese rabbits. So this was the supervisory committee of Dr. Ayla. These were the highlights of the seminar. The rabbits population in Pakistan is 1 million domestic rabbits and 32 million all over the world. Rabbits are small mammals belonging to the family Leproidae under the order Logomorpha. They are widely distributed across the world and thrives in diverse habitats, including the meadows, forests, grasslands, and woodlands. As a global livestock species, rabbits play an important role in meat production and small-scale farming system. And these animals are being used for research purpose because they are gentle, having a gentle temperament, calm behavior, making them easy to handle and manage. They are a low production cost compared to a large livestock species like cow, buffalo, or even the small livestock like goat and sheep. They are more expensive. Therefore, the performance of a experimental study is a more expensive. Uh, these rabbits having a rapid reproductive life cycle and with a short gestation periods and early puberty. They are fast growth rate, having a high production efficiency, excellent feed conversion ratio (FCR), that is a 2 to 2.3 on a grain-based diets, whereas 3 to 3.8 forage-based diets, high quality meat profile, low fat, 4%, whereas the low cholesterol, low caloric value is 160 kilocalories per 100 grams. The obesity is a condition in which the excessive body fat accumulation in the body due to an imbalance between energy intake and energy expenditure, leading to a body weight significantly higher than the normal range for age and breed. So the breed and the age varies the accumulation of the fat. Therefore, the normal uh, weight of the rabbit is 1.8 to 2.5 kg. That's 1800 to 2500 grams. Whereas the obese animals or obese rabbits have the 3 kg or 3000 grams, uh, which is showing the heavy accumulation of the fat in the body. The obesity may cause the digestive issues, the joint problems, fatty liver diseases, reduced lifespan. So therefore, they are a good model for obesity research because they have a similar metabolism to a human and they are susceptible to induce the obesity through a diet, whereas the convenient size for lab studies and a short lifespan allows for a quick studies. Uh, Rabbits, the mechanism of the obesity, that's the high calorie diet whenever fed to the rabbits, they and given a less exercise, the lack of the exercise may lead towards a metabolic dysfunction, and this metabolic dysfunction may have to cause the insulin resistance, hyperlipidemia, chronic inflammation, and this may have to lead towards the obesity, and the obesity may have to cause the diabetes, cardiovascular diseases, liver disease, renal issues, and arthritis. And therefore, the remedy for as we are giving to obese animals and humans, that's the antibiotics. So the antibiotics in 2010, they were RS53, 1,150 tons were given, and it is expected that the 1,05,596 tons will be given to the animals, the antibiotic, if we are going with the same pattern of a life to treat the obesity. This may have to cause a 70% to the increase of antibiotics and a 30% increase of antibiotics in humans. Therefore, it is recommended that the prebiotics, that the non-living compounds that promotes the growth of a beneficial bacteria, the beneficial of a prebiotics is to increase the colon health and decrease the toxicity, aid in a more regulated, improved digestion and metabolism, improve the absorption of a minerals such as calcium, and may change the rate at which the body process uh, that carbohydrates may have to be digested. So the probiotics may have live beneficial microorganisms having to be provided to health benefits. They may have to aid the digestion, nutrient absorption, and immune health. May support treatment of IBS, diarrhea, gastrointestinal disorders, as treating the obesity type, the diabetes or a fatty liver disease, or provide the preventive, the treatment against the diseases. So this uh, is one of the alternative of the antibiotics, which may cause the healthy life and healthy food in the shape of a healthy animals. So the prebiotic and probiotics is one of the alternative solution against the use of antibiotics in a human and animals. So the prebiotics may have to be fed good bacteria. So unhealthy gut may have to cause a dysbiosis and inflammation, increase appetite. Therefore, the healthy diet may have to balance the nutrients. A healthy gut may have to balance flora, reduce the inflammation and appetite control. So this may have to reduce the fat mass and reduce the inflammation and control the appetite, and they have to control the insulin sensitivity. So this may have to manage the obesity. So lactobacillus uh, bifidobacterium and as well as the beneficial bacteria may be used as a probiotics to treat the obesity. As we are knowing, the rabbit have the digestive system that's having to ingest the food through a mouth and to simple stomach as to absorb and to digest the food, and that may have to go through a small intestine where the enzymatic activities may have to cause the digestion, and the cecum is one of the major fermentator chamber in the rabbits where the microbial fermentation takes place and volatile fatty acids production may have to be performed. That's acetate and propionate and butyrate, whereas the psychotrophy, which is the re-ingestion of the soft pieces, which has rich B12 or a B vitamin, and then the microbial protein and enhances the nutrient absorption. So then the fecal excretion takes place. This digestion reduces the obesity in the animal rabbits, like a high fiber diet promotes the satiety and gut motility, and recommend that uh, Timothy hay or the leafy greens limited pellets may be fed. The fecal fermentation, the volatile fatty acid production provides the control energy, and that has to balance microbiota, prevents the metabolic disorders. Control energy intake may have to avoid the high carbohydrate or high fat feeds and limited the commercial pellets and sugary feeds, and exercise and activity, the free movement are enriched, reduces the fat accumulation. So the reduction of the obesity in the rabbits via prebiotic and probiotics takes place when we are feeding the prebiotics like aniline or fructose oligosaccharide or a galacto-oligosaccharide, or we are giving a probiotics like a lactobacillus or a bifidobacterium. They alters the gut microbiota and produces the short chain fatty acids and acetate, butyrate, and propionate, which has to cause the health benefits like weight loss, reduced fat mass, improve the insulin sensitivity, better gut health, and enhance the immunity, which has to reduce the obesity and satiety hormones, the GLP-1 and PYY may have to reduce the body weight and fat accumulation. So the inflammation reduce the production, and inflammation has cytokines, improve the gut barrier, and this may have to improve the energy metabolism. The problem statement that's when we are feeding high carbohydrate, high protein diet to the or a high fat diet to the rabbits, that may have to increase the obesity, and that obesity may have caused the cardiovascular diseases, metabolic syndrome, and oxidative stress complications. So obesity is a growing metabolic disorder characterized by excessive fat accumulation and dysregulated glucose metabolism, hyperlipidemia, and systematic inflammation. It disposes the individuals to metabolic syndrome, cardiovascular diseases, oxidative stress-related complications. Although pharmacologically intervention exists, they are often associated with the adverse effect and a high cost. Therefore, the safe, natural, cost-effective alternative are the prebiotics and the probiotics, which have shown a potential in modulating gut microbiota, improving the metabolic homeostasis, and reducing the obesity associated complications. However, the controlled experimental evidence using a standardized diet induced obesity in a rabbits may have the limited experimentation. Therefore, we recommend that the obesity and the treatment of the obesity may be experimentally checked. So high fat diet may have to cause the obesity development, and that may have to lead to increase the body fat and metabolic stress. So physiological changes that increase the WBC immune response and the metabolic imbalance may have to cause the lipid dysregulation, and the inflammation may have to cause tissue damage. And the progress over the 90 days that has to be given the in a control A, the control diet, and the RBC and the WBC were normals, and the group B having a high fat diet which increases the WBC, and then the high fat probiotics may have to reduce the inflammation. So the expected outcome is that the high diet increases the WBC, whereas the treatment of a probiotic may have to reduce the inflammation. So this is the our hypothesis that when we are feeding the high fat diet, it increase the obesity, and when we are giving a probiotic uh, with a high fat diet, that has to reduce the obesity and as well as reduce the damage which is being caused by the inflammation. So material methods, we have three experiments. One was to three distinct diets were given in experiment one, that the control diet, high fat diet, and high fructose diet. We have made even the comparison of three dietary regimes that's the control high carbohydrate, high protein diet. Routinely or mainly, we are supposed to keep the rabbits on four type of the diets. One is the carbohydrate diet, the protein diet, or high fat diet. So we have compared all these uh, diets, carbohydrate, fat, and protein. But we also have the compared the fructose diet because the rabbits are also taking a vegetable and a protein fruits. Therefore, they have to be kept not only a carbohydrate but also on a fructose diet. So we have compared all these four diets and we have concluded that a fat diet is inducing the high obesity in the rabbits. So three dietary regimens were a baseline uh, uh, that the diet control prebiotic and then the probiotic supplemented. So the comparison again, the obese animals were taken and then the obese animal were kept on a basal diet and then one of the group was kept on a prebiotic and other was kept on with the probiotic supplemented. So this has given us the uh, forcing the biomarkers that has indicated that what to do. So 12 week old male amino albinos were randomly assigned to a one group, one of three groups, 20 per group, and control group, high fat group, and high fructose. So 4 weeks adaptation period and 11 weeks experimental period was kept, and this 20 rabbits in each group in experiment 2 they are also being kept. So in experiment 3 the 15 rabbits in each group were kept so that we have to see the impact of the diets. So the adaptation period, as I have told you, that the 4 weeks were left and 11 weeks were 10 weeks for experimental period. In this, we have slaughtered the animals and taken a blood and tissue sample collection. Then the sample collection, the blood analysis, the tissue samples, and the histological investigation were taken. The student has done the method of a histomorphology by which he has observed the histological variation in the obese animal and non-obese. The sample analysis and experiment was uh, equipments were used. The liver, kidney, heart, intestine, tissue collection of for histomorphology were done, whereas in the experiment 2, the blood and biochemical profile in 60 male rabbits, this experiment was examined by a blood biochemical profile. 60 animals were divided into three groups by keeping 20 animals in each group. One was a controlled diet and the other was 85% carbohydrate, and the third group was a high protein diet having a 65% protein. So evaluation of a blood and biochemical profile were taken and diets high in a protein improved hematology. Materials method in this, we have kept the animals, so 20 animals for 4 weeks for adaptation and 10 weeks for experimental period, and the animals were slaughtered. Then the blood and tissue samples were collected, and then that the blood was processed for blood analysis, and the tissue were processed for histological investigation. So the tissue from the liver, the kidney, the intestine, and the heart were taken and then processed. These were the hematological, histological, and biochemical equipments which were used for the experimental purpose. Whereas the experiment 3, in which the prebiotic, probiotic were the groups were made that were the 15 animals, obese animals were kept in one group. So the control group, prebiotic group, probiotic group, in which the 15 animals were kept, and then the evaluation criteria was to see the growth performance, the hematological indicators, biochemical markers, immunological indices, and product quality. So these animals were kept for 10 weeks and 4 weeks for adaptation. The blood samples were processed for hematological purpose, and the uh, platelets were seen, then the WBC were seen. Tissue was kept in a form of 10% formalin, and the histomorphological evaluation were taken, and the histometric analysis was also done. The liver, kidney, intestine, and the heart were kept in the normal saline. Then the biomarkers were identified by a kit method, and histological evaluation was taken by histology for H and E method. So housing and feed rabbits during the trial, these were kept uh, in a groups, and they were fed with the control diet, prebiotic diet, and a probiotic diet. This is a bio weight and a bio pro. These were the ingredients which were used as a supplement in the basal diet to see the biochemical investigation, and as well as the liver, kidney tissue collection, and histomorphological evaluation was taking place. This all was um, carried out in the laboratory, Department of Physiology and Biochemistry. The histological studies were taken at the Jinnah Medical Institute, and it was observed that the data which was collected, that was analyzed by one way ANOVA, then the comparison were shown in the means plus ACM, and the significant level was used, that was 0.05 p-value, and the statistic analysis was done by the SPSS 25 version, and the objectives of the study was to determine the effect of a high fat diet on a weight gain and obesity, physiological and histological parameters, serum glucose, serum cholesterol, and uric acid, hemoglobin levels, and LFT in rabbits, to determine the anti-obesity effect of a probiotic and prebiotics in obese rabbits, to determine the physiological effect of a probiotics and prebiotics on serum glucose and serum cholesterol, uric acid and hemoglobin levels, and LFT in obese rabbits, whereas the biometry was compared the weight of organs, skin measurement, physiological, histological parameters of obese and non-obese animals. So these are the results. The objective one, which was determine the effect of a high fat diet on weight gain and obesity, physiological and histological parameters, serum glucose level, serum cholesterol, uric acid, hemoglobin level, and LFT in rabbits. So we have seen that the the glucose infusion rate was significantly lower in a high fat fructose diet, whereas the cholesterol was significantly lower in the high fructose diet. The triglyceride was significantly higher in a high fructose diet, whereas the non-stratified fatty acids were significantly higher in a high fructose diet. The effect of different diets on the red blood cells have shown on the 90 days, the RBC was significantly higher in a group C, whereas the WBC was significantly higher in the group B, whereas the impact of the diets on the blood hemoglobin was observed that the group C was significantly higher, and the alanine aminotransferase, that was significantly higher in group C, and the aspirate aminotransferase was significantly higher in group B. The glutamate transferase was significantly higher in group C, whereas the albumin was significantly higher in group C. The total protein was higher in group C. The globulin level was significantly higher in group C, whereas the glucose level was significantly higher in group B. The impact of different diets on the blood total cholesterol was observed that the group B was significantly higher, and the group C was significantly higher in the cholesterol, HDL cholesterol, and as well as the LDL cholesterol was higher in the group C, whereas the triglycerol that was higher in the group B, and the total bilirubin was significantly higher in the group B. The the to determine the anti-obesity effect of a probiotic and prebiotic in the obese rabbits, it was observed that on a 12th day, the weight was significantly higher in the group C, whereas the average daily weight gain was significantly higher in the group C, which is the basal diet plus probiotic, whereas uh, the group C has shown that intake was significantly higher. The group C has shown that the feed efficiency was higher in the group C, which is the basal diet and the probiotic, whereas the basal diet and probiotic has a higher pH. The meat has a uh, the moisture, higher moisture in the basal diet and the probiotic group, whereas the higher the protein contents were seen in the basal diet and probiotic. The higher the fat contents were seen in the basal diet and probiotic. Whereas the H was 1.28, that was higher in basal diet and probiotic. The efficiency of a prebiotic or probiotic that meet obese, it is being observed that the higher the circumferences, higher the width, length, and height was seen in the probiotic group. Whereas the group fed with a probiotic supplement has shown that the height, length, and width circumference was higher of a fibula in group C, and the height, length, and width circumference was higher in group C, that was the basal diet and probiotic, and the ulna height was also higher. The height, length, and width circumferences were higher in the basal diet. So, in the obese rabbits, it was seen that the humerus height, length, and width and circumferences were significantly higher than other groups. The thymic labile length was significantly lower in the C group. The thymic labile width was significantly lower in C group. The white pulp length was significantly lower in C group, whereas the white pulp width was significantly lower in C group. The third objective to determine the physiological effect of probiotic and prebiotic on the serum glucose, serum cholesterol, and uric acid, hemoglobin level, and LFT in obese rabbits. It was seen that the obese rabbits having the live body weight was higher than in the group C, whereas the uh, weight gain was higher in group C, whereas the feed intake was lower than group C. The FCR was lower than group C. The PCV was very higher as compared to the A and a B, whereas the hemoglobin was higher in a group as compared to group A and B in group C, whereas the RBC was higher in the group C as compared to group A and B. The WBC were higher in the group C as compared to the lower as compared to the A and the B, whereas the uh, heterophils were higher in the group C. The lymphocytes were lower in the group C, monocytes were lower in the group C, eosinophils were lower in the group C, the basophils were count were lower in the group C, the ratio, SN ratio was lower, higher in the group C, whereas the effect of prebiotic, probiotic, total protein was significantly higher in the group C, whereas the albumin was observed that the group C having a significantly higher ratio, whereas the globulin was higher significantly in group C, whereas the albumin and globulin ratio was higher in group C, whereas the prebiotic and probiotic ALT was lower in group C, whereas the AST was lower in group C. The triglyceride was lower in group C. The total cholesterol was lower in group C. Glucose level was lower in group C. The urea was lower in group C. The creatinine was lower in group C. The photomicrograph of the rabbits, the lymph nodes have shown significantly change in the group C, and as well as the intralobular lobules were significantly shown a different the structure, histological structure in group C, whereas the photomicrograph of rabbits of normal spleen have shown the significantly the changes in the group C, whereas the rabbits with a normal intestine have shown significantly changes in the intestinal structure to determine the physiological effect of a prebiotic probiotic on a serum glucose level, serum cholesterol level, uric acid, hemoglobin have to be seen over here. We have discussed already. And now the fourth, to compare the biometry, weight of the organs, skin measurement, and physiologically, histologically. And though we have seen that the final weight, the weight gain, the average weight, and the BMI, the thoracic circumference, abdominal circumference, and skin thickness was significantly higher in obese rabbits as compared to non-obese rabbits. The heart rate, the pulse rate, and the blood pressure was significantly higher in obese rate as compared to non-obese rate. So liver, heart, kidney, lung, spleen, pancreas, gastrointestinal tract, and gastrointestinal tract empty was significantly higher in obese rabbits than the non-obese rabbits. The villus height, the villus width, the crepe depth, villus height, the lamina propria thickness, and as well as the muscularis thickness and global cell count was significantly higher in obese rabbits. The skin and the liver, the kidney and the heart has significantly um, higher value than in obese rabbits than non-obese rabbits. So this is shown that the obese rabbits having a significantly high fat accumulation in the intestine, in the heart tissue, in the spleen, and as well as in the liver. So the liver, the kidney, the small intestine, the skin, and the heart has shown significantly higher fat accumulation in these organs as compared to non-obese rabbits. High fat diets significantly increase the body weight and fat deposition in rabbits, demonstrating their role in inducing obesity. High fructose diet caused metabolic disturbances included hyperglycemia, elevated triglyceride, insulin resistance, indicating a metabolic syndrome. Protein-rich diets improve the hematological parameters, serum protein levels, suggesting the better physiological metabolic status. Carbohydrate-rich diets increase the blood glucose, triglyceride, liver enzymes, and then the cell counts, indicating a metabolic stress and inflammation. So probiotic supplementation improve the growth performance, immune response, and the produce the high quality meat in obese rabbits and proving a more effective than the prebiotic. Uh, the conclusion, the prebiotic supplementation supports the growth of a beneficial intestinal microbiota, optimize the nutrient utilization, facilitate the heart rate, healthy weight regulation, and improve the overall physiological resilience. Whereas the strategic dietary modulation through a balanced macronutrient composition, microbiota targeted supplementation represent an effective approach for a metabolic regulation, long-term health improvement in rabbits. This research recommends that avoid the excessive dietary fat and refine the sugars in rabbit feed formulation to prevent the metabolic disturbances and obesity-related complications. Ensure the balanced and adequate protein levels to support the optimum hematological parameters, oxygen transport, and physiological performance. Restrict the prolonged high carbohydrate feeding strategies to minimize the risk of a metabolic syndrome and impaired gut health. Incorporate the scientifically validated prebiotic and probiotic to improve the gut microbiota, to increase the nutrient utilization, immune response, and overall metabolic health. Whereas the further research is recommended to optimize the probiotic, prebiotic, and symbiotic doses, explore their long physiological and biochemical effects. This was the research publication published by my students, and this was the seminar which was delivered by, Dr. Raila, and she has acknowledged the Department of Pharmacology, Basic Medical Sciences Institute of Jinnah Hospital, Karachi, the chairman, the dean, the faculty of Animal Veterinary Science, the director of Advanced Studies, supervisory committee, colleagues, and departmental staff. She also acknowledged the parents and the family. So housing and feeding rabbits during a trial, they were kept and they are being given the prebiotic supplements and a probiotic supplement with a basal diet. So these were the animals which were obese animals and they were big. And then this was the prebiotic and probiotic supplemented in a basal diet. This was the equipments which were used for the experimental purpose, whereas these animals were kept in a, basic um, medical institute, whereas these were being initial weight, and then the all those samples were processed and hematological and biochemical investigation were taken in the Department of Physiology and Biochemistry, whereas the Dr. Raila is operating all these animals hematologically, biochemically, and even taking a liver, kidney, heart, and intestinal tissues. This is the picture gallery, which is showing the performance of the student at various stages of a study, and then she has histologically examined, and then she said thank you, and if there is any query about this seminar or any query about the research or any question which may have to develop. So we say that the obesity is a dangerous globally and it should be treated, and the animal and the human should be maintained balanced and smart so that there shouldn't be any um, liver disease, heart disease, or even arthritis, or even the oxidative stress may not develop. So thank you very much. Okay, Allah Hafiz.